Now new at 6, with South Florida slowly reopening, we know how important it is to maintain social distancing to avoid a spike of cases in our communities. But one segment of the population has to be even more cautious once they start going out. CBS 4's Hank Tester has more.
Senior citizens aren't going to like this story, but it's sound advice from a doctor who works with seniors all the time. He says you might have to be staying inside a lot longer than you think. Boat ramps open. Seems everybody wants to get on the water. Check out the parks. Pretty obvious folks want out of self-quarantine, sheltering in. And among that crowd, especially in Florida, that want out the door, those over 65.
It's just too risky for the elderly. So I'm telling my patients, I understand everyone's really edgy, everyone wants to go out.
The doctor works a lot with seniors, and he's not talking about patients in nursing homes, but those who are used to being out and about, active.
Look, we do know that healthy people who exercise more tend to get less bad effects from it, right? So certainly a 77-year-old who's otherwise fit and healthy is much better shape than a 77-year-old who smokes, who has congestive heart failure, or who has diabetes, for example. So relatively, someone like that would be less risk.
But those underlying issues like heart, lung, ailments, they present a danger. Same for diabetes and
people who are getting chemotherapy at extremely high risk, but people that have a prior history of cancer and it's been cured and they've been, without any relapse in the last several years, they're probably, and they're otherwise healthy, up in a much better shape than somebody who has active cancer and is getting chemotherapy.
So what to do for seniors that really have no issues, that see the crowds on the street, hear talk about opening up? Patience is a word from the doctor, and seniors are going to need it. Listen up.
I'm telling my patients, and my elderly patients, I'm telling them I would feel much better if they waited till July. Certainly, I would not tell them right now to go outside and start exercising and start socializing. That's definitely not the right advice. I'm just telling them I'd rather be much safer. And if my mom has to stay one more month in her apartment and not go out and not get sick, I think it's worth the risk.
The older you are, the greater the risk. Even if you're in great shape, the doctor says, heed the caution. And if you have questions, call your personal physician. Good advice for seniors. I'm Hank Tester, CBS 4 News.